Hey you guys, it's student nurse Alexis, and today I'm going to be doing a lecture on my smartphone proposed tracking app to help stop the maternal rates of maternal, mother, infant, and mortality rates. Okay, so first we're going to talk about what is preeclampsia, okay? Because this is a disease that a lot of Black women face, and their symptoms are often gone unnoticed or not taken seriously by the provider, right? So preeclampsia is high blood pressure in pregnancy that can lead to seizures. So preeclampsia is before the seizure, eclampsia meaning seizure, right? We're going to give a medication called magnesium sulfate, and we need that calcium gluconate readily available at the bedside, okay? We're going to monitor for diminished reflexes, and we're going to monitor for low respirations. That's like one of the biggest things, right? Our patient will have like diminished reflexes and low breaths if that calcium gluconate is having an adverse effect, right? Then we can also have our preeclampsia develop into HELP syndrome, right? Where we have elevated liver enzymes. That's not good, you know? And it really severely increases the risk of postpartum hemorrhage, which is really one of the #1 killers of Black women when giving birth. So my machine learning based predictive analytic app, right? What you're going to do is the patient is going to have a device like if you think about like the fetal heart rate non-stress test where they press that button, same thing but with a device now. Every time you feel something that doesn't feel right or you feel some type of symptom, go ahead and click that button and kind of just report down, like chart down, you know, what you felt and whatever, and then it's going to be connected to your doctor. So when your doctor sees, hey, something is not looking here, or your nurse, hey, something is not looking good here. And it also is really good because we can remotely monitor, and it creates remote work as well, which is really good. You know, maybe you might be a little anxious. Hey, just the heart rate is going really high, right? Chat in and check in with the provider or the nurse, you know, but that is connected to the nurse or the doctor, and the provider can give you a snap back and say, hey, look, you need to come in so we can further examine you, you know? Why are we telling patients that shortness of breath is common in pregnancy? Obviously, they're going to be a little fatigued and have a harder time, but we're talking about a chronic shortness of breath where you cannot catch your breath. Your baby's not getting enough oxygen, you know, and the provider and the members on the team need to work and do their absolute best to reduce these maternal infant mortality rates, okay? We know that sometimes, you guys, I'm in the lounge area in my apartment, and I'm sorry y'all have to hear that, but the show must go on. Well, they are really loud. Forgot what I was saying. Technology may fail, and we still need to be able to rely on what we have, right? So how can we reduce these maternal mortality rates, right, without an app, right? Check on your loved ones. The village is raising the baby. If you see your friend and she's something's a little off, right? You're gonna want her to like let your friend know, like, hey girl, you might want to take a trip to the doctor. Let's go like check you in with the provider. Like, let's go see what's going on there, you know? And at the end of the day, we're all here to promote health. That's the role of a nurse, provide patient education, okay? That's what we are here for, okay? So thank you guys for watching. And of course, if you guys have any questions, feel free to reach out. Hope you enjoyed the video.